I wonder if we can turn to electronic healthcare records just a moment. This was not a subject that I, at least, intended to spend this much time on this year. But the more we got into it, the more I saw, and I think most of us saw, that the program was in a ditch and that we might have an opportunity to help get it out of the ditch. I mean, in talking to distinguished research universities whose hospitals had been using electronic healthcare records for a long time and consider it a vital program, they would say that stage 1 of the program was very helpful, stage 2 was tolerable, and that they were terrified by stage 3, the doctors and the hospitals. This is after the taxpayers had already spent $30 billion. But as we looked at the work we were doing, and we saw the President's precision medicine initiative actually absolutely depends on the success of electronic medical records, and most of the other things that we're advocating have to do with that. We set about to try to change that. So we had 6 hearings on it. We worked together because we had such bipartisan interest in it, and we worked with the administration. This is an area where it's more of a management problem than it is a legislative problem. And I'd like to give Secretary Burwell and Karen DeSalvo and Andy Slavitt at CMS credit for working with us to try to solve the problem. Now, they didn't take all my advice, which I wish they had. I thought they should have delayed meaningful use 3 for a year and used that time to work with physicians to reduce unnecessary documentation. I mean, go out to the doctors of the country and say, if you're spending 50% of your time filling out forms, then either you're doing something wrong or we're doing something wrong. Let's work together to fix that. I think the physicians of this country would have appreciated that and would have begun to see electronic medical records as more of an aid than something they dread. I also saw that the President and Secretary Burwell are trying to move toward a new system of how doctors are paid. And we're setting that system up, and how electronic medical records are used is an important part of how that system. It seemed to me that it would make more sense during this next year to work with the doctors and to align electronic healthcare records stage 3 with this new incentive system. But that didn't happen. Nevertheless, I want to reiterate that I think the administration has worked well with us, and I think we can continue to do that over the remaining time the administration is here, and I'm going to urge them to do it. The areas, I'll put my remarks into the record about it, but the areas that our bill that Senator Murray and I worked on with many of you focuses on the fact that to cut down on the time doctors are spending on paperwork rather than caring for patients. That's number 1. Number 2, it helps providers understand more about the health IT products they buy. That's number 2. To reduce information blocking, which really means there's some obstacle getting in the way of a person's health information getting shared between providers, and that could be because one provider refuses to share the information or charges a big fee, or because simply they don't talk to each other, the systems don't. Another step that our bill would take is to help those systems achieve interoperability and communicate with one another. And 5, to help patients have better access to their own records. My medical health information is mine, and that's the law, but most Americans don't really understand that and have a difficult time getting access to their own information. So I think we're doing as much as we can think of to do in a legislative way to try to move this along in the next few months. Senator Whitehouse has mentioned 3 other areas that need important attention. I think this is a real contribution that we can make to better health care for all Americans, and I appreciate Senator Murray's work on it and the work of so many members of the committee. Senator Murray, do you or other members have something?